history of mental health, clinical psychology, and psychotherapy has always been intertwined with the social, cultural, and technological developments of Western civilization. Today, our understanding of mental illnesses and psychological suffering, as well as our perception of the tools and practices available to address these conditions, face a new challenge in the ever-expanding presence of artificial intelligence. In order to discuss what is implied in this future scenario, we want to welcome you on a fascinating journey into the past as we explore the formal asylum of Santa Maria della Pietà in Rome. This imposing complex, once a residence for the mentally ill, holds a rich history spanning nearly 2 centuries of human experiences and the evolution of mental illness treatment. Within its walls, we glimpse into the darkness of the past, also while discovering the progress society has made in understanding and caring for mental illnesses. As we venture inside these spaces, we will uncover the different eras that have shaped the history of Santa Maria della Pietà. From its humble beginnings as a hospital for the poor and destitute to its transformation into an asylum during the 19th century, Santa Maria della Pietà witnessed shifting concepts of mental illness and the various therapeutic approaches employed over time. For example, this was the place where Italian psychiatrists Hugo Scherletti and Lucio Bini invented electroshock in 1938, a technique aimed more to punish the patients than cure them. While this was an unethical choice for our contemporary standards, at the time, asylums provided a space for taking care of patients, providing them with structured schedule and an organized environment for receiving treatments. This pivotal concepts of psychological intervention, space and time.
So we have known since the beginning of the so-called digital turn, the digital revolution, that information and communication technologies have revisited our idea of space and time by creating a new kind of environment that just overlapped with our physical, social and relational environment as we know it before. I'm talking, of course, about digital environments represented not just by the old-fashioned World Wide Web, but above all by the new media like social network and these new informational and relational environments that are not virtual, since the effects that they can have on our actual life, but of course they are not material as the other forms of environment that we know. Nowadays we are facing a new challenge, and this challenge is related to the way we are going to treat mental illnesses and mental conditions in and through these digital environments. I'm referring more precisely to the introduction not just of e-therapy services, like for example those companies that have decided to devote themselves to providing and delivering therapy and counseling by digital services, like for example online call or online meeting, just like we did for conferences and for teaching. But we are witnessing a new phase of this transition, of this revolution, and more accurately, we are starting to see the introduction of both artificial intelligences as agents able to provide support and relief to patients. The situation in this respect can be seen from different angles and different points of view. On one hand, we should consider the fact that having a service, having a counseling service, a support service that is available 24/7 and that can be accessed from any location. It doesn't matter if you are at your place or if you are working or traveling in the middle of the night. If you feel the need for receiving some support, you can access this. On the other hand, this lack of space and time also entails something that has to do with the reason why I decided to have this first seminar of ours, little seminar of ours here. Places like this one, places like the Santa Maria della Pietà Asylum didn't just embody the atrocities of what psychiatry was in the past, with a lot of violent therapies, a lot of punishment that was presented as a form of therapy, while in fact was something more to be ascribed to sort of a vengeance forced education of people suffering from mental conditions by the outside society. But at the same time, this place embodies also an idea about the relationship that exists between people who take care of other people, namely psychotherapists, psychiatrists on one hand, and on the other hand, patients. Having places like this one, while they can seem, because in fact they were sorts of prisons, on the other hand, they also tell us something about the idea of having a proactive human relationship at the core of any therapy, of any counseling session, of any agenda for getting better, for overcoming the origins of your trauma, of any other mental condition that somebody can have, by exploiting everything that is at the very core of the human relationship, of a human relationship, like empathy, like compassion, like the ability to take the perspective of the others. That's what, in my opinion, is more concerning about the introduction of artificial intelligences in counseling sessions. We have seen that in the last few years, several services of this kind have emerged. Just to name a few of them, the Coco, the Wisa apps, together with Pixir by the Pix Health company, and the Hobot, they all have provided chatbots that are aimed to offer to a specific sector of the population suffering from a specific condition, mostly depression, but not just that. Social anxiety is on the second place. 24/7 relief in respect to their condition. And while this can be interesting, because in several aspects these ICTs, these artificial intelligences, can work as an external commitment device by pushing and reminding and organizing the schedule of the sessions for somebody suffering and maybe also having issues in accessing the service of mental health care. On the other hand, there can be some backlashes that can actually impact a lot the outcome of the therapy itself. For example, the idea of being able to take care of your own schedule can also lead to a situation where you can perceive that you are doing great in the progression of your therapy, while you are not, because the feedback from the therapist is completely lacking. Or maybe worse, if we think about, for example, the case of teenagers that are in recent years affected the sector of the population who's affected the most by new forms of mental illness, we can imagine scenarios like this one. People receiving a therapy exclusively online, exclusively delivered by a bot, and after a failure in perceiving a progress in this, they can decide, for example, to give up with therapy and never get back to it. Because we know very well what kind of mental barriers, mental obstacles can appear in this. This is something that we should keep in mind while when deciding and when reflecting on the role of these new technologies in the field of psychology, and especially in the field of psychotherapy and counseling. And that's also the reason why I believe that we should carry on a critical comparison between those ancient forms of mental treatment, the contemporary ones, and what is going to be the next big thing in this respect. Another possible consequence of the introduction of artificial intelligence in all the counseling system, the psychotherapy system, can obviously be the fact that, just like we have seen for algorithms that have been used in services like content streaming, YouTube, Netflix, Prime Video, Apple TV Plus, and so on, if we leave to an AI the responsibility to decide what kind of patient has to be sent to a specific therapist, a specific counselor, or a specific psychiatrist, we are put in danger in both the autonomy of decision in respect to the right choice from the perspective of the patient, but also on the other side, also on the other hand, we can have some negative consequences for therapists themselves. Because of course, if the algorithm will learn that a specific counselor is very skilled, according to what parameters I don't know, in a specific condition, the AI could decide to send to that physician exclusively one category of patient. This is something that can put at risk also one of the tenets of this profession, that is in fact the opportunity that a psychotherapist has to grow up continuously and to train continuously himself or herself by knowing new individual backgrounds, new phenomenologies of specific mental conditions, and at the same time also all those opportunities to figure out a possible solution, a possible therapeutic strategy in order to treat a patient by understanding and comparing the different situations and different outcomes from other patients. Well, all these can in fact just be hidden and put and swept under the rug of these new very important presence that will be this sort of manager and director of psychotherapy in the form of an artificial intelligence.